Welcome to another desert edition of familydoctor.expert. I'm Dr. Grant Blashki and I'm out here on a beautiful ride this morning in the middle of the desert, and I was reflecting on my upcoming birthday and thinking that I and a lot of my friends are getting pretty close to the big 5-0, and there's a whole lot of checkup things that we can do. Why would you want to go and have a checkup? Well, the unfortunate reality is that there are two main disease groups that are going to catch up with most of us: the cardiovascular diseases, strokes, heart attacks, all that fun stuff, and the cancers, skin cancers and prostate cancers and breast cancers and all these annoying things. But the good news is there's a lot we can do to pick these things up early, and we're getting better and better at preventing it. So what are the things that you can do at your GP? Let's talk about the cardiovascular diseases. Get a blood test, get cholesterol checked and all your lipids, get the sugar checked. Lots of people have diabetes and they don't know that they've got it. Get your blood pressure checked. Sounds boring, but lots of people have high blood pressure and they don't know about it. Don't smoke and do lots of exercise, and doing these things together drastically can reduce your cardiovascular risk and seriously head off trouble. What about the cancers? Well, first of all, everyone should get a skin check. Most of us in Australia anyway, we were the generation that went out and got burned every summer, and this does put us at risk of skin cancers. Other cancers, the ladies, there's a bunch of tests you should have done, especially over 50. Mammograms are recommended. You should be already having pap smears every 2 years anyway. Bowel cancer is really common, and there's a great test that everyone can do. It sounds a bit yuck, but it works. You send off a little poo sample, what's called the fecal occult blood test, and they can pick up tiny amounts of blood in it and pick up bowel cancers early. So I highly recommend that. More generally, have a chat with your GP. Maybe you've got a strong family history of particular cancers, and in that case, the doctor may recommend that you have some special tests. For instance, if you've got a strong family history of bowel cancer, your doctor will send you off to have a colonoscopy. Now, with the blokes, the prostate cancer issue is a little bit vexed. There's been lots of debate amongst the medical profession as to whether or not you should have a prostate blood test or the digital examination to see if the prostate's enlarged. It's not as clear-cut as a lot of the ladies' tests, and generally I don't check for prostate cancer as a preventive thing unless I've had a good chat about it with the blokes about the risks and benefits. So there's some really simple things that you can do to prevent heart disease and to prevent cancers, to pick these problems up early. There's a bunch of other preventive things that are good to do. Get your eyes checked. A lot of people are getting the presbyopia. You go out for dinner with people, they're holding the menu as far away as they can, and while they're looking at your eyes, get them to check your pressure. A lot of people get glaucoma, which is pressure in the eyes, which can cause visual troubles down. Why don't people go for checkups? Well, there's lots of reasons. Firstly, we're all busy, and secondly, we can't be bothered, and thirdly, I'm sure the psychologists would have something to say about denial and not really wanting to face up to this stuff. Here's my suggestion: if it's your birthday coming up, make your birthday a time to book a GP visit and get a checkup. So anyway, having a checkup is really worthwhile, easy to do, don't ignore it, have fun. All the best from familydoctor.expert.